Triage, that is the word medical professionals use when deciding who to treat first in a situation with a lot of patients. An expert in bioethics tells our reporter Andres Gutierrez that is exactly what healthcare workers may need to do as more people contract COVID-19.
While Kansas and Missouri are weeks away from hitting their expected peaks with COVID-19 cases, right now hospitals are deciding how those life-saving resources will be distributed during that critical time.
This is all about saving the most lives possible.
Dr. Terrace Rizal with the Center for Practical Bioethics says hospitals are developing a point system to determine who gets a life-saving ventilator and who doesn't.
Is there heart failure, liver, some other sorts of failure? All of that would matter. What we want to do is make them clinical criteria, not social worth, even social usefulness.
Hospitals in the metro are turning to the state for guidance and to articles like this one in the New England Journal of Medicine written to prepare doctors for these tough decisions.
And it does come down to giving it to those people where we're either going to save the most number of lives or the most number of life years. And yes, it does mean that people with other severe illnesses will receive a lower priority score.
Roselle believes now is the time for people to prepare for the worst case scenario.
We're going to be looking at every patient on their own merits. Also, does this patient want this intervention, CPR or something else?
Roselle adds that doctors in our area are under another pressure.
There's concern about liability risk. Will I be sued when I'm doing the best I can, but somebody ends up dying? And so I'm hoping that the governor in both states makes the declaration of legal immunity for those who are operating under crisis standards of care and who are just doing their best.
Critical decisions to come in these unprecedented times. In Kansas City, Andres Gutierrez, 41 Action News.